Doctor Says 360. Smooth and Joyful Pregnancy 360 is brought to you by KL Fertility Center to help you with your pregnancy journey.
Hi, I'm Dr. Jasdev Singh, son of Harbhajan Singh. I'm one of the fertility specialists at KL Fertility Center.
Does both husband and wife need to learn about our family history first?
So, does both husband and wife need to learn about our family history first, in case we have genetic disorders that may affect our baby? Well, if you have a family health history that includes a birth defect, a developmental disability, newborn screening disorder, or genetic condition, you might be more likely to have a baby with this condition. Learning more about your family health history before you get pregnant can give you time to address any concerns you have. Remember to consider the family health history of both potential parents, not just the mother. Be sure to discuss any concerns with your fertility doctor. Based on your family health history, your doctor might refer you for a genetic counselling. Other reasons you may need genetic counselling including having had certain infertility issues, 2 or more miscarriages, a previous pregnancy or child with a genetic condition or birth defect. After genetic counselling, you might need to decide to have genetic testing for conditions that could affect your baby. Results from this test could impact your pregnancy planning. Testing before you get pregnant can give you time to think about what the results mean for you and your partner and consider all your options. Parents can have a baby with a genetic condition even though neither parent has it. Babies inherit 2 copies of a gene, one from each parent. For some genetic conditions, the baby will only have the condition if both copies of the gene related to the condition do not work properly. In cases like this, each parent has 1 copy of the gene that works properly and one that does not. If the baby inherits both the non-working copies of the gene, the baby has the condition. Thus, the parents are called carriers for the condition, meaning that they don't have the conditions themselves, but they can have children with it. If a genetic condition runs in your family, you might be a carrier for that condition. Likewise, you might be a carrier for genetic conditions that are more common in your racial or ethnic group. Examples include thalassemia like alpha thalassemia or beta thalassemia. Your doctor might ask if you want to have screening called carrier screening to test if you are a carrier for conditions that are most common in your racial or ethnic group. If the results show that you are a carrier for a genetic condition, the other parent would also need to have a carrier screening to know if you could have a baby with the condition. Have a family health history checklist when you are planning for pregnancy. Number 1. Gather family history information before seeing the doctor. Number 2. Tell your doctor if you have any family members with a genetic condition, chromosomal abnormalities, developmental disabilities, birth defects, newborn screening disorders, or other problems at birth or during infancy or childhood. Especially if you had a previous pregnancy or child affected by one of these conditions. Talk to those family members if possible to find out of their specific diagnosis. Ask for a copy of the genetic or diagnostic test result, if any, to share with your doctor. It makes things easier for you and your doctor as well. Alert your doctor if you have had a previous premature birth, miscarriage, stillbirth, or a child who died from sudden infant death syndrome, which is known as SIDS. Follow your doctor's recommendation. For example, if you had a previous pregnancy or child affected by spina bifida or anencephaly, the doctor might recommend that you take a higher than normal dose of the vitamins, folic acid, before and during pregnancy. All these are important because we can prevent some conditions by doing IVF and testing the embryos and transferring the normal embryos back to you to prevent you from having a child with a disease.
We know fertility problems can be stressful. KL Fertility Center has gotten something for you in your journey to getting pregnant. Currently, we have a pocket-friendly IVF Rama package, priced affordably at only 9,998 ringgit. The package includes consultations and scans during IVF, IVF medications, IVF laboratory fees, Blessed culture, ICSI, and more. Want to know more? Visit klfertility.com now. Terms and conditions apply. Doctor Says 360 specially invited KL Fertility Center to help you have a smooth and joyful pregnancy. Wishing you all the best.
If you like our channel, please like, share, and subscribe.